Welcome to another episode of our podcast, Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me we have, for the second time already, Faye Donald. How are you, Faye?
I'm very well, thank you.
So it's always a pleasure to have you here in Nyon. So it's bringing to this rainy day some sunshine. And of course your British accent, that is always nice to hear. So we were planning to talk about mental health, and all of a sudden you told me a story yesterday that I said, no, okay, we're gonna change the topic. And this story is about a practice that you started, right? And it is a perio practice. But okay, I will let you
Well,
tell
it's
it.
a referral practice.
Yeah.
So the practice accepts referrals for implants, for orthodontics, for cosmetic work, and for perio referrals as well.
Yeah. So, and what's happened? Because you just arrived with your own airflow prophylaxis master under the arm, and you start working on the patients.
Yeah. So I approached the owner of this practice, which was a high-end practice that I noticed didn't have GBT in it. It was in my area. I was looking for somewhere where I could grow as a clinician, and it kind of was the perfect fit for me. So I approached the practice owner and said, I just need you to believe in me. You don't have to make any investment because look, I got my machine under my arm and I've got all the kit and I've got it all. And I spent some time describing GBT to her. She felt that it aligned with the values of that practice and where the practice was going. Really kind of liked the idea and the sound of it. So she pretty much gave me a free range and said, okay, show me what you can do. And I think that initially some of the clinicians, I wouldn't say that they doubted me, but I don't think they saw the benefits necessarily. Yeah. But that was just even more of a challenge to me. It just makes me want to push even harder and even further. So I felt that it was the type of place where actually the standard that I was delivering, the results, the treatment results, was what was going to get me noticed and get them to recognise actually what could be achieved. So yeah, off I went on my journey and got my head down and my sleeves rolled up and started working hard. Didn't push the idea too much at all. I just wanted to let the results speak for themselves and see what happened, really. And of course, what happened was the results did exactly what I knew they would do. And particularly the clinician that takes the perio referrals now accepts that the standards of non-surgical that I can achieve with GBT are, as good as he was achieving, with all these other different conventional methods. So the way it works now is that he does the consultation as the specialist, accepts the referral, does the consultation. I do all of the non-surgical work, and then he does the review and any onward surgical work that might be needed. However, there's very little. There's very little of that because of the success that we're getting with GBT. And he's also gone on to invest in GBT in his own practice, away from this practice, because, the results just said it all for me.
Because that's the best thing that we have. It's like we just not talk the talk, we walk the walk also, right? So it's like show by the results that what we can achieve with non-surgical periodontal treatment and by implementing GBT in that way. And you told me that there was this patient, this particular case, where nothing could be done because there was perio everywhere with a lot of missing teeth, right?
Yeah, that was an implant case. So the case came into the implant dentist. He looked in the mouth and, as you rightly say, almost wrote it off really as a case that wasn't suitable for implants. We couldn't deliver what this patient wanted because of the extent of the periodontal disease activity. And of course, there's no way that we would put implants into a mouth that's got active periodontal disease. Of
course.
And prior to me being there, he admitted that he would have referred that patient back to their own dentist saying, I'm sorry, there's nothing that we can do for this patient. But because I was there flying my GBT flag and insisting that I could make a difference to these patients, he thought, well, okay, let's send this one on to Faye then. And his expectations were quite low, which was fine because it was quite an advanced case. And yeah, sure enough, I turned it around, and 18 months later, that patient was signed off as being suitable for implants. Of course, he remains very high risk because of his history of periodontal disease, but the patient had gone through 2 rounds of non-surgical therapy with GBT, had stopped smoking in the process, so we'd eliminated the other risk factors. And the patient went on to have, £33,000 worth of treatment done with the implant dentist. So, when you look at things like return on investment, and when you talk about what can we actually achieve for these patients, what difference can we actually make to their lives, you might just see this as, some equipment that you're investing in for your hygienist, but actually that treatment was the difference between that patient not having what they'd originally wanted and ending up with full dentures, and actually, getting the result that they wanted and getting the implants that they wanted, and, going around smiling from ear to ear as a result of it. So I think that's the less quantifiable side of GBT that we don't always get to see, but is certainly just as significant.
No, that's the thing. Like we are touching people and changing lives. So how Maurice said, do good, feel good. That's what we are doing through GBT. But it's also something that is less invasive, and you are producing business by being ethical. Because look, what we have done with these patients, like you try to help him in the less invasive way. There was results, and these results then it was referring to the implantologist, so we could have then the rest of the treatment, the treatment plan. So indirectly, we are also touching the revenue of the clinic quite often with GBT. Tell me one thing. Like GBT started 7-8 years ago, and you are one of the first ones in this restrict group that got presented the first draft of what will become GBT. And you told me that at the time it was so confusing. Like, what is this? But you took the flight off and you wrote this amazing letter, how this could change your life. Can you talk about that moment? Because I think it's such a nice story that need to be shared here.
Yeah. So I remember getting this initial email from a former member of the EMS family saying, we've got the first GBT summit, the first launch of GBT, and we'd really like you to come to Switzerland and present for us. And I remember getting this email and thinking, I don't know what that is. What's GBT? I don't know what GBT is. And I was Googling it, trying to kind of, what's this GBT? But hey, someone was inviting me out to Switzerland, so why would I say no to that? So off I went, and I'd been asked to put this presentation together. I didn't fully understand what was being asked of me, but when I questioned it, the answer I got was, well, just show us what you're doing, show us what happens in surgery every day. So that's what I did. I just put a case together, a short 15-minute case. It was an implant case of kind of what I was achieving every day. And I sat, and in the morning, there were specialists speaking way above my pay grade about kind of what they were achieving with perio patients and implant cases in their kind of clinics that were all over the world, and it was really impressive. But I sat there at first feeling a little bit small, not really sure why I was there. But then the more I listened to them and these kind of extensive treatment plans that they had, and I was watching the results that they were getting, the more I kind of started to sit up a little bit and think, well, hang on a minute, I'm getting those results. And I'm not a specialist, and I've not got this fancy clinic and all these appointments and, antimicrobial interventions and all sorts. I haven't got all of that. I'm just doing what I do, and I'm doing it in a much shorter time as well. So by the time I got up on the stage, which was later on that afternoon, honestly, I felt 10 feet tall, and I was so excited to say, it's all brilliant. Everything I've seen today is brilliant. But let me tell you what I can achieve in this really short space of time using GBT, which I then understand is what I was doing anyway, using GBT and using this equipment, and I'm getting the same results. And I don't need the anesthetics, and I don't need all of these appointments, and I don't need systemic antibiotics, and I don't need surgery. Look what I can achieve. And at the end of that, I was so nervous talking about it, standing up there. But at the end of that, I had such a warm response to it. And, you know, people that I've held on pedestals and looked up to all of my career coming up to me and saying, you know, what you were saying was really right, actually, if you're addressing the root cause of the problem. And if you've got a protocol and equipment that you can approach that and work on it and address that, then actually you're right. You're kind of going to eliminate and prevent all of this other treatment possibly even needing being done at all, or you're certainly going to significantly limit it. So there was born the start of my GBT journey, and I've been banging the drum ever since to anybody that'll listen to me.
You were in that period. You were in a period that you were questioning yourself, like if you should continue dental hygiene or not.
Very much so. I think prior to discovering GBT and prior to finding equipment that aligned with the standards that I had. My standards are really high. I really push myself, and I want the very best of everything for my patients. And I just hadn't really found a way of delivering that and achieving it. You know, we have, particularly in the UK, time constraints are a big issue for us. So we've sort of got shorter appointments, but great expectations. And I was just finding the pressure of under-delivering, not meeting the standards that I'd set myself, really challenging. So what I wanted to achieve was not what I was achieving, and I didn't know how to fill that void. How can I get to those standards? And I think when you aren't meeting the standards that you set yourself, you feel as though you're falling short every day. It's really demoralizing. It's soul destroying. You know, and I just got to a point where I thought, I'm not sure that I even want to continue with this journey. I think I'd rather be no hygienist than be a hygienist that feels a little bit deflated every day. I couldn't see a way of kind of getting out of that. And then I discovered GBT, and the rest is history. You know, suddenly I then had the protocol and the product that aligned with what I was trying to achieve. And, you know, the two came together and we made great music.
Literally. Because I saw a video from you dancing and singing.
Can I just say that video was recorded way before TikTok was a thing. Nobody was making dancing videos and singing along to music at the time.
Unfortunately, it's only on your computer. But I had the pleasure to see it last time that I was in Manchester.
Yeah, it's definitely out there on the net somewhere.
I need to find it out. If I find it out, I will share with everyone that I know. It was so funny.
I think at the time, that was a second visit to Switzerland, I'd been asked to talk about what difference GBT had made to my life and how much happier I was as a clinician. And of course, when you're happy at work, then you're happy outside of work as well. So it didn't matter what I wrote. It didn't quite capture what it was that I was trying to say. So I thought, hey, I know what I'm going to do. I'm going to sing and dance my way through this and dance down the street with my GBT machine and have dinner with it, and hopefully people will be able to see just how happy it's made me.
Hugo, let's find that video and we're gonna link to this podcast episode because it was too good. I saw that video. I was laughing the full length of it.
Yeah, something I teach my daughter, who's a teenager now, is be really aware of the content that you put out, because spoken words can kind of disappear off into the air. But anything that you write down or record and goes out there is there forever.
Forever.
And I think I wish I might have heeded my own advice on that
No,
one.
that was so good. No, honestly, the people that see that, it just see Faye.
I think it was just so pure, so genuine. And I still feel that way now. I still skip to work. I still feel that way. Every patient that comes in, and the more complex and the more difficult and the more troubled that patient is, the more I enjoy them, the more I embrace them, the more I want to help them, because I know that I can change it. You know, I see lots of really anxious, really nervous patients, and you know, our brains are very good at reminding us of threatening situations.
Mm-hmm.
So it records that information, holds on to it. So it reminds us not to, I don't know, walk out in front of a bus or whatever every day. It doesn't tell us that, it just reminds us. But unfortunately, it does that with traumatic experiences like going to see the dentist. So as soon as that patient walks in the surgery, you see their whole body language changes, the spoken language changes, the body language changes, and that's their brain telling them, this, I'm reminding you, this is not a good situation for you to be in. But that's all learned behaviour. So what we have to do is teach the patient to bypass that thought process and give them some new experiences so that they can bypass that. The brain will start to relate that to wherever they were when that happened, but when they come and see me and have GBT, then it's a completely different experience. So every patient that comes to me, the more troubled, the better, because I know that I'm going to make a difference to these people. I can trust GBT. I know that it's going to suit them. I know that it's not going to trigger any of their fears or anxieties or phobias that they've got. And at the end of it, these patients are going to be skipping down the street like I do, waving the GBT flag, wanting to tell everybody. And I think I get more and more patients from personal recommendations. So patients saying, oh, you should go and see this lady because, you know, this is what happened to me and I went to see her, and just gives them an entirely different experience. Everything that they think a hygiene appointment is, it doesn't play to that narrative at all. It sidesteps all of that and says, okay, let's start from the beginning. First of all, tell me about you. Tell me what's going on outside of your mouth. What happens outside of your life? Tell me about your lifestyle choices. Tell me about your stress levels. And, you know, for some of these patients, it's the first time anybody's ever asked them. I'll say to them, where do your dental anxieties come from? What's happened in the past? Why are you coming to me as nervous as you are? And there's always a story to tell. And sometimes it's the first time they've felt understood, not only listened to, but also understood. And this is all part of the GBT experience. It's not just that the physical removal and disruption of biofilm is warmer and more gentle and quicker and different experience, is that they're met by a totally different approach, a totally different clinician. And it kind of derails them a little bit, which makes them more vulnerable, but actually makes them open up more to me as well. Because once I understand what's going on with that patient, then I can address it and make them feel better and ultimately healthier. And, you know, they're going to go on to hopefully keep the teeth for the rest of their life. And
you see the patient as a whole. Actually, and there's this side that is important for the listeners to know, that you have a degree in the patient behavior,
a diploma in counselling skills and behavioural therapy.
Yeah, that's it. And you apply this every single time with your patients. That makes a huge difference, because every single time that I see you on stage talking about clinical cases, you start by the behavior of the patient. Not only the behavior of the patient, but also your behavior. How you talk with the patient, how you explain, how you act, and just give, I wouldn't say too much of yourself, but you give yourself to the patient. You open also. So,
I think until you understand, because the patient's clinical needs are the patient's clinical needs, they're all the same in terms of what is it that they need to make this periodontal situation better. We need to manage the biofilm, we need to change the behaviour at home and the lifestyle choices. So those kind of three categories don't really change.
Yeah.
But in order to do those things, we have to engage that patient. That patient has to want to make those changes. And that motivation always comes from within. I can't give that to them. It's not a piece of paper that I can slide across the desk and give to them. Here's motivation. Put it in your pocket. You've got it forever. It's got to come from them wanting to do it. And I want to do the things that matter to me in my life, things that I understand, things that matter, motivate me to want to do them. So I apply that theory to my patients as well. So you've got to start by listening to them. What are the problems? What's important to you? What are you hoping to get from this? And then from there, you can build. There's your building blocks, and we can kind of tailor that then and make it bespoke and channel it to patients, not just to meet what they need, which I can do anyway, but also what they want. And that's when I think a patient feels valued. And that's really important to me.
Told you this in the first episode that we recorded in the first season of this podcast. And I'm going to tell you again, you are the most human hygienist that I know. Because you always relate yourself with the patient. And I think I already saw 3-4 different cases, and they always start the same thing. What are you expecting from me? How can I help you?
Yeah.
And continue doing this, because it's just you. It's Faye.
Yeah, my opening line to all my patients is, my name's Faye, and I'm here to help you. Tell me how I can help you. Tell me what's brought you here today. And I think it just instantly relaxes them. It's not an approach. Rather than them being told what they need all the time, they're being asked, what is it that you want? How can I help you? And, it's about breaking down barriers and that's all part of how I get the results that I get with these patients that, go on to have their implants or don't need their surgical treatment because the non-surgical perio treatment worked. It's all, we have to treat the whole person and not just the mouth. Treat the perio, treat the person, not the perio. That's my motto.
That I heard already a couple of times. Yeah. If you can give an advice, you already left here a lot of tips. But if you can give an advice for all the clinicians that are hearing us, what would you say?
Yeah, look beyond the biofilm is where I would start. Yes, we know what the etiological factors are that are involved in periodontal disease, and managing those is crucial. But before we get to that point, look beyond the biofilm. Who's sitting in front of you? What's stopping them? What is it? What barriers are in place? What has stopped them from looking after themselves, or what's made them make the choices that they're making? And we can't solve everything, unfortunately. I don't have a magic wand, but look beyond that. What are these patients' needs? And once you've established them, then build from there and build the rapport.
We had Professor Sigram Eich here recording a podcast also that we were talking about microbiome, oral biofilm. And she said one thing that it's also in line here. It's like, okay, to remove the biofilm, the only way is the mechanical removal. But the most important is the change habits.
Yeah.
And that's what you are saying here today.
Yeah, because we can all remove the biofilm, right? That's what I was taught to do. Clinically, that's my skill. I can remove biofilm, but preventing that biofilm from it's going to return, but preventing it from having the opportunity to mature and go on to cause disease, that's where the real skill is. That's what we have to focus on. And what I particularly love about GBT is that it doesn't just focus on the treatment. It focuses very prevention-led. So it's a real prevention-led module protocol. And that's what it's focusing on. So the treatment comes secondary, prevention comes first. And that's where we need to intercept. That's the area that gets overlooked. And we fast forward to the treatment and give this patient this amazing experience. But actually, let's just take a couple of steps back. So we can't stop this biofilm from coming back, but how can we stop it from maturing?
Agree. Faye, thank you so much. Again,
always a pleasure.
I'm a Faye Donald fan, so
I'm a GBT fan, so
you can come here anytime.
Thank you.
So for all the listeners, thank you for being with us. So remember, see beyond the biofilm. And don't forget to subscribe in all the platforms that you are listening to this podcast. So it's been Spotify, on Apple Podcasts, on YouTube, and we have now the podcast season 1, season 2, also on the Swiss Dental Academy website. So thank you so much, and see you next time.